is going to be for the Pediatric Intraosseous Infusion Skill Station for the Advanced EMT for National Registry. Like normal, you come in the room or the area, they're going to introduce themselves, they'll ask you your name, then they're going to read you a set of instructions. Alright, so those instructions are going to be something along the lines of welcome to the Pediatric Intraosseous Infusion Skill Station. This skill is designed to test your ability to establish an intraosseous infusion, or IO, for a pediatric patient just as you would in the field. You'll have a maximum of 2 attempts to establish a patent and flowing IO infusion within 6 minutes. Within this time limit, you will be required to properly administer fluid to a pediatric patient just as you would in the field based on a given scenario. Although we are using the mannequin, you should conduct yourself as if this were a real patient. You should assume that I'm the parent of this patient, and you may ask me any questions you would normally ask in the situation. Do you have any questions? Okay, here's your time. If you have questions, ask them. If you see some unfamiliar equipment, ask about it. Take a minute, ask them to look, all right, let me look and see. All right, I've got 2 needles here. Let me see what the difference is, I've got a 3-way stopcock. I've got an IO extension set. So take the time, look at all of your equipment, make sure you've got everything that you need. Now, once again, I like to put my stuff in order. So that would be like, all right, we got this. The first thing we're going to look at is going to be our fluids and such. Then we're going to prepare our tubing. Then we're going to have, our cleansing, our support, our tapes in there. We're going to have our needles, and you just kind of line it up in the order that you would normally use it. Okay, then we're going to have our aspiration, then we'll have our flush securing and our needle device. So I like to put everything kind of in order. You don't have to do that, but I just make sure that everything is there. Because if you start and you're like, okay, yeah, I'm good, and you start and somebody has lost your needle and you don't have a needle, well, like I just knocked off the 3-way stopcock. I don't know where it went. Guess I'll find it a little while. Alright, so like that. They just lose something, you don't have it. Well, guess what? You are out of luck. Alright, so after you've looked at your stuff, you make sure everything's there, now we're going to get a scenario. So they're going to give you a small scenario about this little baby here. It's going to be something to the effect of something's happened to this small child. They're going to give you a weight of the child, and you're going to have to give them fluids. Whatever the problem is, they're going to need fluids. So that weight will come in handy, or come into play here in a little while at the end when you adjust your flow rate and bolus as appropriate. You've got to calculate that. And you get a piece of paper and a pencil. You don't get a calculator. So make sure that you can do that, and we'll walk through that as well. So we'll come up with the weight here in a little bit. Let's go through this part first. So the first thing, like normal, we're going to look at our fluids. It's sodium chloride. It's the proper fluid. It's clear. There's nothing funky, nothing discolored, nothing floating in it. We're good there. It is not expired. All right, this is Dimidose. It doesn't have an expiration date, but we'll pretend it's not expired. All right, so that's correct. Next, we're going to make sure we've got the rest of our equipment ready. So we've got an appropriate IV administration set. All right, make sure that your protective tails, your covers here, are on so that we maintain sterility. All right, so that's there. We've got an extension set. You could also have a 3-way stopcock, but I knocked mine off somewhere. I don't know where it went. So I'm going to go with the extension set today. You will see this one's different from a normal one because it's got a special hub there that's designed to connect with it and minimize problems. Okay. You'll need a flush to flush your tubing. We've got to clear the air out of this tubing here. We've got our saline flush here for once we've established it. We've got our cleaning agents, we've got tape, we've got securing devices, we've got our drill, we've got a syringe if we wish to aspirate, and we've got our needles and our marking. So we've got everything we need, and we've got our sharps container. So everything we need is here. So next thing we're going to do is get ready. We're going to prepare the administration set. So like normal, we're going to take our tops off. Okay. Insert twisting motion, not touching it. Flip it over, fill up the drip chamber a little bit, about halfway or so. We're going to open this up, and we're going to watch all the bubbles flow out. And then that is ready and prepared, so we're going to set this over to the side, leaving our protective tail in place. We're going to set that over here. The next thing we're going to do is prepare our extension set. So we're going to take our extension set, make sure it's not locked, Gonna open it up out of a package. We'll say this is a 10 cc drop. It usually takes about 3 mLs to completely flush this. We're gonna flush this full of saline, so it is now locked with saline. All right. Now, if you have a regular saline flush, depending on the size of your flushes, you can flush with part of it and leave this attached, and then you have the rest of this flush to flush for patency once you've established it. We would want to leave a cap on here as well. We're going to set that to the side. Okay, so we've got all that stuff now. If you're going to use tape for your securing device, you can go ahead and you can have your bulky dressing to secure with and your tape, have that torn, set off to the side here. If you are using one of these securing devices, then you just make sure everything's there and it's ready to go as well. Alright, so we've got that done. We've torn our tape. We've got our stuff there. We've got our PPE on. You can do your PPE from the beginning like I have, or at this point you can put it on. You just have to have it on before you do the puncture. You can prep everything, but once you go to puncture, you got to have your PPE on. Alright, so we're going to find the anatomical site for this puncture. So for pediatrics, we're looking for the tibial tuberosity. It's this little point that kind of sticks out right here. Peds usually is going to be 1 finger width in, 1 knuckle basically, and 1 down. So we're going to come up right here. Adults usually going to do 2, but it's going to be just slightly on the inside, slightly medial of the midline, all right here. So once we've identified our proper site, we're going to cleanse it appropriately. Ideally, we would use iodine or ChloraPrep if they're not allergic, but if we don't have that option, then alcohol, just like IVs. Small circles, inward to outwards, let it dry. If it doesn't dry, it doesn't do its job appropriately. Next thing we're going to do is take our appropriate needle. Now, there's a big difference in needle size. Okay, little bitty baby needle, big old adult needle. The key here is, you see these little black lines? There's a line, there's a line, get where I can see it, there's a line. When you go to insert these, okay, you're going to put it on the drill, you're going to insert. You do not want to put your hand back here like this, because if you miss, you're going to drill yourself. It's not going to feel good. You're going to have to stabilize without cupping, okay? So whether you're coming over like this, whether you're stabilizing here, however, whatever method you're choosing, you cannot have your hand back here. So we're going to stabilize. We're going to come in at a 90 degree. This is dried now. We're going to come in at 90 degree. You want to push this needle in straight forward, not pulling the trigger, just push it in. It should go in through the skin easily until you feel bone. Then you want to look at your needle and you want to make sure you still have one of those little black lines available or visible above the skin. If you do, now little bitty baby, this is not, you're going to have plenty of space, but on a larger adult, especially a obese adult, you will have, there's a possibility you may not have enough needle to reach the bone marrow. You have to check for that black line to make sure you've got at least one black line visible above the skin. If you do not, you have to remove it and go up to the next size needle. You want to do this beforehand, because once you drill that leg, you can't do anything else with it if it's not big enough. You've got to go to the other leg. Okay, so insert to the bone. You feel their 90 degree angle to the bone. Now we're going to let it do the work. Minimal pressure is all you need for the drill. If you have a manual, then you insert with a twisting motion. Okay, so pull this off, set it to the side. Now we are going to remove our stylet. It goes into the sharps or one of these little sharps containers right there. Okay, just go ahead and put that over there. Now we've got this in here. We've removed the stylet. Now, if you wish, you can put an empty syringe and aspirate. You don't have to aspirate, okay? Some of them may be dry sticks. If you aspirate, remove what you've aspirated, set it to the side, transport it with you. I personally aspirate whenever I drill, but that's just my personal preference. You do not have to do this, all right? But if you do, do not flush it back in, because then you could create an emboli. We don't want to do that. So we take our pre-flushed extension set, going to hook it on, and we're going to go ahead and flush it, okay? And it should flush. You may have to give it a little bit of force right at first to kind of clear out a little pocket there for fluids. All right, so we're going to ensure that we're filling around this site, make sure we don't have any swelling, anything like this. In a conscious patient, this will hurt. So if at the paramedic level, if you're doing this, you want to make sure you give them some lidocaine if possible to try to numb that area. But advanced level, you don't have that option most of the time. It's going to hurt, okay? Just be aware. It's going to hurt them. So we're going to do that. Now we're going to dispose of that properly. All right, you may lock it, you may not lock it, depends on what you got. Then we are going to, if we need to cleanse the port again, we can. We're going to take our saline here. Oh, and you know what I forgot? This thing right here. If you are securing with your bulky dressing, okay, you can secure with bulky dressing, tape around it, no problems. If you are not securing with your bulky dressing, if you are using this bad boy right here, it will not fit. Oh, I guess it does fit. The other one I had. Most of the time there's a little inner piece. This one's missing the inner piece. There's a little inner piece that does not fit over this all the way. So you would actually need to place it like that before you hooked up your extension set. Then you would peel the taping away and just kind of secure it to the leg like that. All right, and this is your old guard piece. That hard plastic's going to keep it from getting dislodged. All right. Then we take our connection there. We cleanse the port. We connect it. We open it up to the appropriate fluid bolus rate. Now, here's where we get that fluid bolus. All right, so let's say that patient is 18 pounds. All right, so 18 pounds. We're going to figure out the kilograms because it's 20 milliliters per kilogram is our fluid bolus. So 18 pounds, 18 divided by 2 is 9. And then to get your 0.2, you're going to take off 10% of that. So 10% of 9 is 0.9. So 9 minus 0.9 gives you 8.1, which would round to 8 milliliters, or 8 kilograms. So 20 times 8, take your 2, multiply it times your 8, that's 16, add your 0 back. So 160 milliliters would be your fluid volume. So now we're going to adjust our flow rate to deliver 160 milliliters. Okay? Now, if that's as far as you have to go, awesome. If not, then you may have to go further with your drip set. You take your drip set, which is 10. You take your amount of fluid to administer, divide it, or times your drip set, and divide it by your time. So let's say we want to give that over 30 minutes. So it'd be 160 milliliters of our volume. A 10 drop set gives us 1600 milliliters divided by 30 minutes gives us 53.3 drops a minute. We can't give a 0.3. So we're going to adjust this and count these drops till we get right there, till we get 53 drops. So fair amount fast, all right? 53 drops a minute, and we're going to reassess. We've got it secured. We're good to go. We're done.